Hi there, this is Dr. Tansavatdi. It's towards the end of the day, but I decided let's do a video today on ethnic rhinoplasty. I had promised to do this 2 days ago, or actually yesterday, and I just had time out of my busy schedule to put this broadcast together. So we're going to start by asking a couple questions that we've already prepared about ethnic rhinoplasty. The first question is what is an ethnic rhinoplasty and what are the anatomic differences that make an ethnic rhinoplasty different than a traditional rhinoplasty? So in my practice, I do a good number of rhinoplasty cases, and a portion of those cases are ethnic rhinoplasty. And an ethnic nose, we're talking about Asian, African American, Hispanic noses have a different anatomy than the traditional Caucasian white nose. So how are those differences, how do those differences make the rhinoplasty more difficult or easier, or what do we expect from that? Well, the rhinoplasty surgery is a little bit more different. It is more difficult in that the tissue, the anatomy, has to be taken into account. The skin is thicker in Asian American as well as African American noses. The width of the nose is also wider in Asian American as well as African American noses, and some Hispanic. And that may be a cultural difference that is normal for their face, and we have to take that into account because we do not want to narrow the nose too much such that it doesn't fit their face. So an ethnic rhinoplasty is different in the measurements, in how the anatomy of the nose appears on the face, and how we want to get a natural appearance. And that's my goal with an ethnic rhinoplasty, a natural appearance for that cultural difference of the face. Another difference is in that an Asian nose, Asian American nose, has a low bridge. We call the radix, as well as the dorsum is lower, such as my nose. And so some patients want an elevated bridge of the nose, which makes a more refined nose, and it can often mellow out the features on an Asian American nose. So we do that either through non-surgical means with fillers that I've already discussed last week, but also we can do that with the use of implants such as silicone implants, and the use of your own cartilage, either rib or ear cartilage, that's then buried under the skin. Now, using cartilage is a really nice technique in that it creates a more natural appearance. However, implants are just as good, and it's a faster recovery. Implants, though, do have a small amount of risk of infection, and I have to deal with that in my practice as well from other. I just saw one this week of a patient who had silicone implants placed and now is having infections. So there are some complications and risks with having a silicone implant. So was there another question there that we had?
Well, who is a good candidate, Dr. Tan?
A good candidate for ethnic rhinoplasty is the same for a traditional rhinoplasty, in that, you know, as long as you have good expectations, clear expectations that are clear and that are realistic, that fit with the nose, then and the face, then those expectations can be met, and those are good candidates. Again, the thickness of the skin limits how much we can refine the tip of the nose. So we can't expect with an Asian American nose to be able to get such a refined tip where we have a very pointed tip. That's more Caucasian nose. So because of the thickness of the skin, we can't attempt to get it too refined, and so those changes won't show. And as long as you're realistic about those expectations, and you're a good candidate.
Who is not a good candidate, Dr. Tansavatdi, in terms of skin? They have to do with the skin.
Yes, the thickness of the skin. We can't narrow the nostrils too much either. If we narrow it too much, it can affect breathing. If we narrow the tip too much, it can affect breathing. So all those things are important to discuss with the patient, that they know that.
And what can the patient expect after surgery? What are the expectations after surgery?
After surgery, due to the thickness of the skin in Asians as well as African American, the result of the surgery may take longer than a traditional rhinoplasty. The results may take a year and a half, maybe up to 2 years, because the swelling at the tip of the nose takes the longest to come down. And so the final result may take that extended period of time, and it's good to be patient in that result, in waiting for that final outcome, and not rush into asking for a revision, asking for another procedure. It's good to wait, and it's hard sometimes to hold patients' hands and say, look, I know you're concerned, you want to get this tip to look the best, but you also have to trust that there is still some swelling there, and you have to wait for that final result to show.
Now, why should we choose a plastic surgeon who specializes in rhinoplasty or ethnic rhinoplasty versus just a general plastic surgeon?
Well, I will say there are a lot of general plastic surgeons out there that have a good deal of experience in rhinoplasty. The average plastic surgeon operates on maybe 8 noses in a year. And plastic surgeons who specialize in just rhinoplasty are the ones that you want to go see. A majority of my practice is rhinoplasty cases, and the experience that you get, this is probably, I would say, the hardest surgery to get just right, because there's such nuances and such tiny details, fine changes that you can make to the nose that make a huge difference. A millimeter makes a huge difference on the nose. So you have to have somebody who has that eye, the detail, as well as they have the experience on how the nose is going to heal. Because somebody who doesn't have that experience might rush into doing a lot more, and it actually can be a bad outcome for the patient. So they have to be patient, and they have to be conservative with how much they do. Also, the result, in terms of like the time frame of how long to wait, what to expect, those are things that come with time, with experience on doing lots of noses, lots of rhinoplasty cases, and especially ethnic rhinoplasty cases. So.
Thank you, Dr. T.